Christina David says she and her husband Simon were left to fend for themselves just when they needed help the most. He was a mechanical engineer until 2017. Now, a stroke and dementia have left him bedridden. He relies on twice daily visits from personal support workers, trained to secure him in a lift so he can be cleaned and use the washroom. All that stopped on December 31st when Christina David told his care teams she had tested positive for COVID-19.
They told me that immediately they will cancel the services when I disclosed that I was infected.
Sick, she struggled to care for him alone. She says he spent 3 days soiled in his bed while also having COVID symptoms himself. Desperate, she eventually called her 26-year-old stepdaughter to help lift, clean, and feed him. Then, she too caught COVID.
I felt terrible. This shouldn't have happened.
Simon David is in the care of the Mississauga-Halton Local Health Integration Network, or LHIN. In turn, they contract his care to the VON, Victorian Order of Nurses. Both agencies declined to answer specific questions about the situation, citing privacy concerns. In emailed statements, both insisted personal support workers are well trained to deal with COVID-19. The health network says in the event of a problem, it tries to find alternate care. But for 6 days, Christina David says they received nothing.
It's not the responsibility of the people who are, very, very ill at the time to be filling the holes in their care.
Alison Thompson researches ethics in healthcare.
The obligation is on the part of the home care provider to make sure that the patients are being cared for.
David says partial care has resumed, but she's been told full care won't resume until tomorrow, 14 days after her COVID diagnosis. John Lancaster, CBC News, Toronto.